So I'm sure a lot of our listeners are wondering what ozone therapy is. So that let's answer that burning question.
Yeah, so I mean, there's tons of different types of ozone therapy. I do basically it's an ozone dialysis. So there's another type that's called 10 pass ozone, where they're going to take 250 cc's of blood out, about half of what you would have in a blood donation. They inject that blood volume with ozone gas and then reinfuse it into that same vein. The reason why ozone therapy has had kind of a bad rap in the past is, there's risks with that type of ozone therapy. So there's a risk of air embolism, and then people can have a reaction to the ozone. And when you do it that way, you can't control the amount of ozone gas that's given because you've reinfused it. And so if a patient has a reaction, you have to stop the procedure right there. I do a much more gradual ozone therapy, so ozone dialysis. So you would have two IVs in. Your blood is passed through a Henry Schein medical grade dialysis filter. And then after the blood is filtered, then it's saturated with oxygen and ozone and then reinfused into the vein and the other arm. And so you're basically on a pump, which is circulating your normal heart rate, blood volume. So very small amounts of blood are taken out at any given time, and you stay on this machine for 45 minutes in the hopes that we get anywhere from 3 to 4 liters of your blood filtered and saturated with oxygen and ozone. And then what the ozone therapy does is, there's a big push in medicine right now for, that little bit of stress at the cellular level is activating the immune system. It's helping start the antioxidants being used in the body in a better way. It's that stress that our body needs to perform optimally. And there's tons of benefits from ozone, but that's kind of it in a nutshell. Decreasing that inflammation, putting that stress at the cellular level to really activate the immune system and help it function into the best possible way that it can.